Well, hello. Welcome to the Wellness by Design podcast today. I'm Jane Hogan, the wellness engineer, your host, and I'm delighted to be able to share the wisdom of Dr. Kelly McCann with you today. Dr. Kelly's an expert in a lot of things, but we're going to talk specifically today about Mast Cell Activation Syndrome, which is, to me, kind of a new thing. It's probably not new. We're going to learn more about it. Dr. Kelly hosted a whole summit on this, so she's very knowledgeable. And so I think she's the best person for me to have on this podcast to share information with you about mast cell activation. So welcome, Kelly.
Thank you, Jane. Thank you so much for having me. I really appreciate it.
Well, I think this is going to be really eye-opening for people, and you've got a lot of valuable information to share. So I'm delighted. I'm going to tell people a little bit more about you. So Kelly McCann is a medical doctor. She's a leader in the field of integrative and functional medicine. She serves on the board of directors for two professional organizations and lectures regularly to colleagues all over the world on various topics, including mold, mycotoxin illness, chronic infections, mast cell activation, which we're going to be talking about today, and environmental medicine. Educating both colleagues and patients is her passion. At her private practice, the Spring Center in Costa Mesa, California, she works with many complex chronically ill patients, utilizing the best of conventional and integrative medicine to support them on their healing journey. She's a triple board certified doctor in internal medicine, pediatrics, and integrative medicine through ABPS. We are really lucky to have you here because it sounds like Dr. Kelly, you're not afraid to take on complex cases. And I
No.
heard you recently on the Science of Healing and Consciousness Summit with Lloyd
Mhm.
Burrell, and a really interesting conversation you had there about sort of linking all these very complex things together. And anyway, I mast cell activation is, I think, can be complicated. I don't know. We're going to find out more from you today. Like, for the audience who hasn't really heard about this, what is mast cell activation syndrome?
Sure. So let's talk about what mast cells are.
Oh, even better.
Even better. So we'll talk about that because these are normal immune cells. Their job is to survey the environment that your body is in, looking for foreign invaders. They
Mhm.
tend to live at the areas of interface. So they live in our respiratory tract, upper, lower respiratory tract. They live in the gastrointestinal tract. They're on the skin. They have an affinity to hang out near our blood vessels. They hang out near our nerves and our nerve endings, and they're a lot in the brain too. And they are filled with these chemical messengers that we call mediators. And those chemical messengers are things like cytokines and chemokines, histamine, serotonin, heparin. Um, we now know about a cytokine storm thanks to COVID, and it's the mast cells that are a big part of that cytokine storm that are causing that inflammatory response, because that is the way that we fight things. So when we're exposed to a virus, a mold, Lyme disease, environmental chemicals, toxins, our mast cells rally to produce an inflammatory response that we need to try and fight that foreign invader. Now, then hopefully the foreign invader goes away. We get over our virus, we get over the flu or COVID or whatever we're struggling with, and then everything quiets back down again and the inflammation goes away and we're good. But for some lucky, unlucky people, their mast cells get triggered into being activated all the time. And so they're hyper responsive, hyper vigilant, worried, and constantly surveilling for foreign invaders. And they start to misperceive things that should be okay, like the food that we're eating, the smell of a chemical in the room. Not that chemicals are good for us, but it's an overreaction.
Right.
And as a result, patients with this syndrome can have all sorts of symptoms. And if you think about it, because these mast cells exist everywhere in the body, and anything in the body could present as a mast cell symptom.
Wow. So is it similar to like molecular mimicry like that we see in autoimmune conditions? Does it always go with autoimmune, or is it separate from autoimmune? How does that
That's a
work?
very good question. So it's not an autoimmune condition. An
Okay.
autoimmune condition is where you're really mounting an antibody response against your own tissues. And this is more, more in a allergic kind of sense. And so
Okay.
a lot of people who may have allergies, it's a spectrum, right? So there are some people that have, seasonal allergies, and they're kind of annoying, and they can manage them with, some supplements or maybe some nasal sprays. And then there are some people that are debilitated by their allergies or their food sensitivities. And these people may or may not actually have this condition called mast cell activation. So there's potentially a lot of overlap.
Okay. So interesting that you said spectrum, which totally makes sense. So do people, the far end of the spectrum would be mast cell activation syndrome, but presumably before that, before they get to that diagnosis, or right at that far end of the spectrum, there are signs along the way that they are moving along the spectrum. So what would be some ways that people might know that they're moving along the spectrum?
Sure, that's a great question. Um, for example, and this is usually historically how it goes. So, for a patient, when they finally show up in my office, or they are so debilitated that they need to find a practitioner, the clues are in the history.
Right.
So you go back and start to pay attention. Okay, I was an allergic kid. I had a lot of eczema, or maybe they had asthma when they were a child. And maybe it got better, maybe it didn't. Maybe they had food sensitivities. And there seems to be this stepwise progression. So you start off with a few symptoms, and then over time, as there are what I call hits. So maybe you grew up in a moldy house, but then you got out of the moldy house, but then you had, another toxin exposure, or maybe you got bit by a tick. And so over time, you're going to see an escalation in the inflammatory or allergic symptoms that somebody has. And it can start to expand. So you start out with some food sensitivities, but they get worse over time. And then all of a sudden you're getting palpitations and chest pain, you're getting migraines, you're getting irritable bowel symptoms, and more systems are becoming involved in, your daily experience. That is likely the person that may have mast cell activation. Um, so I think about it as a multi-system,
Mm.
multi-symptom condition. So if you just have like food sensitivities, but nothing else going on, then you probably just have food sensitivities, or maybe histamine intolerance. If you just have allergies, then that's it. But if you're starting to realize that, I get these headaches all the time, and I have irritable bowel and diarrhea issues, or constipation, I have nerve problems, urinary bladder problems, for women, endometriosis or painful periods, heavy periods, bruising. There's all of these symptoms that can show up for people. And as they kind of snowball, that's a clue that more and more, that they're more likely to have mast cell activation.
Sounds very tricky because a lot of those are very loosey-goosey kind of symptoms, right? Oh, I got
Oh,
some
yeah.
headaches. Oh, I've got, my digestion's not working so well. Oh, my skin's a little bit itchy. And, all these different kinds of symptoms. I know you said it's not autoimmune, but can it trigger autoimmune?
That's a good question. The way that I really think about it is, it's not the mast cells that are triggering the autoimmune. It's actually a different part of the immune system.
Okay.
It's the trigger. So say somebody is in a moldy building, that mold causes an inflammatory response in the body. It can trigger mast cell activation. It can also trigger the immune system to attack itself or attack tissues of the body. So you can get more allergies, you can get mast cell activation, you can get autoimmune conditions because of that trigger. That's
Okay,
how we
so
think
it's
about it.
like common root cause, but
Yes,
activation is different.
correct. Correct. Yeah,
Okay.
those are great questions, and thank you for asking them, because I
Well,
know it is very confusing for people. It's like, my immune system is off. Is it an autoimmune condition?
yeah.
No, it's an overactivation issue.
Right. I just kind of thinking back to my own path, and years before the autoimmune rheumatoid arthritis diagnosis, I had chemical sensitivity. I had to stop swimming in a public pool because I couldn't tolerate chlorine anymore. And then I started noticing I didn't digest dairy so well. Nothing major would happen. I just noticed a lot of gurgling after ice cream, things like that. So those are things that could have eventually triggered a mast cell activation, but in my case, I guess triggered the autoimmune to happen. So
Right.
different.
Um, yes. And interestingly enough, we know from some of the genetic studies out of Germany, 17% of the population has mast cell activation.
Wow.
So almost 20% of the population, right? That's huge. That's a
Okay, so
huge number
one
of
in
people.
1 in 5 people. So if you've got
One
a
in five
family of
people.
5, chances are one person in your family. That's pretty high. It's a lot higher than I would have suspected.
And
So
and I
what
actually
I
think with things like COVID, it may even be higher than that.
right.
Many of those long haul patients, it may be a component of mast cell activation that has been triggered by the virus, and now it's inflammation gone rogue.
Right. Okay, so we've talked about some symptoms and of inflammation gone rogue. If someone's listening to this right now and they're listening to the symptoms that you're talking about, what should they do? Like, what's their first step? I mean,
Yeah.
can they work through this on their own? Do they need to work with a practitioner? What would you say? You're a
And there
practitioner, so I know you're going to say work with a
Well,
practitioner, I
you
would think.
can definitely do some of this on your own, right? So, um, so there's kind of two things happening simultaneously. There's the reactions that you're having, and then there's the triggers that are exacerbating those reactions. And you need to do both things. So you need to look for the root cause, and you need to calm down the mast cells. And oftentimes with people, the more and more sensitive they get, like with your chemical sensitivity, you had to remove that chemical from your exposure, right?
Mhm.
So you have to remove those exposures and then quiet down those mast cells. And sometimes you have to quiet down the mast cells first before you can even like address the toxic exposure. So some of the things that you can do as an individual without a practitioner, or while you're looking for a practitioner, is find the things that you're eating or that you're exposed to that are making it worse. So, the thing we have the most control over is our diet.
Yeah.
It may be that dairy is an issue, gluten's an issue, sugar's an issue. It could be other foods that are an issue. There are foods that are very high in histamine that may benefit you greatly if you take them out of your diet.
What are some of
So
those foods?
things like tomatoes, avocados, very, very high. Everybody thinks, oh, avocado is great for me, right? No, it's a very high histamine food. It may really bother you. Fermented foods, again, we think they're great for us, but they're not great for people with mast cell activation and histamine intolerance. Even just things like processed foods, leftovers can be a huge problem for people. So avoiding leftovers, fermented foods, those are some ideas. And there's plenty of lists out there that you can check into.
And I suppose people could do like a little experiment, right, on themselves, because actually it does come down to you and what works for you. So, try, okay, let's try for this week to not have histamines and see how I do? Or what happens if I stop eating gluten, dairy, and sugar? Are there any other foods that really stand out? Well, the processed foods you mentioned as well. Any like
Yeah.
fats and things like that that are
Fats
exasperating?
less so. Fish. uh, it's going to be more the things that are processed. For some people, it's the wine and, alcohol is hugely problematic. Um, Kombucha, kimchi, all the fermented foods. Bone broth can be really triggering for people. Again, bone
I
broth is
know.
so nourishing, but not great
Yeah,
for high histamine.
right.
So exploring histamine foods is something that you can do. In fact, you have to do that. You have to do that on your own. You don't necessarily need a practitioner to do that. And then for a lot of my mast cell patients, they'll come in on antihistamines because they already will have determined that antihistamines, things like Claritin, Zyrtec, Allegra, Zysol, Benadryl, those are helpful. And so I encourage patients to try those. And then there are lots and lots of supplements that are great for histamine issues and mast cell issues. Quercetin, one of my favorites is pycnogenol. It's good for so many things, anti-inflammatory, turmeric, resveratrol, paramine, luteolin. And there's so many things out there that are readily available that people can try. My one suggestion is if something seems to be helpful, you may want to take a higher dose than is recommended. So I find that sometimes people need antihistamines twice a day, or they need quercetin 3 times a day, as opposed to one pill once a day. You might get greater benefit. And this is all, unfortunately, trial and error. We don't have any way of knowing who's going to respond to which things. And then most people need layers of things because these mast cells are producing thousands of different chemicals. We need to try and block and calm them down. And really, the diet, the supplements, even pharmaceuticals, that's just one piece of the puzzle. The other piece that we need to deal with is the mind-body connection.
Ah, it always comes down to the mind-body connection, doesn't it? So
It does.
well, it's kind of like you can do all those other things and they can take you so far, but then you've got to address the mind-body connection because maybe it's the mind-body connection that puts you in a position to make you susceptible, right?
Yes,
Is that something you see in your practice?
absolutely. Every day.
Mm,
Every day. I I think that it is the mind-body connection, that we come into this world and we have experiences in our family, and some of those experiences are terrible and traumatic, and yet even for people who have a happy childhood, we have misperceptions and misbeliefs about our experience in our lives
yeah,
that set us up, and then we perpetually believe these things, and even if they're not true, right? So we are, in my belief system, divine beings having a human experience, right? We're
hmm,
spiritual beings and we have lessons to learn. And some of these lessons we get to learn through our physical manifestations. And so your body is speaking to you and it's telling you things and it's saying, hey, I need help. I need things to shift, right? Um,
hmm,
I almost find that this conversation is easier to have with patients who have cancer, right? Because when you have cancer, it's like, oh,
yeah,
I have a potential death sentence. I got to do something. I have to change the environment in which that cancer grew in the first place, right?
right.
Right. So there's a huge incentive for those folks who have cancer. With
Mm,
mast cell activation, it's the same thing. Not
yeah,
that you have cancer, not that you're going to die. Um, there's no reduction in life expectancy with this condition. It's not like that. But the body's saying the environment in which this condition has manifested is now, it's not working. It's
Oh,
not working.
you are speaking my language, Kelly. This is exactly what I talk about. It doesn't really matter what the condition is. We've created an environment where that condition can grow, but the power in it is that we can change the environment.
Yes.
But it's not just the physical environment, as you said, it's mind, body, and spirit all together. So what are some mind body practices that, and well, let's throw spirit in there as well, mind body
Yeah.
spirit practices that are helpful?
There are so many out there. I think about it uh, as it's almost like a stool, right? You've got three legs on your stool. You've got mast cell activation, and then there's limbic system activation, and then there's vagus nerve dysfunction, right? So the vagus nerve is the autonomic nervous system. This is the part of our nervous system that is either fight or flight or freeze, and um, and rest and digest, very simply. And many people who have mast cell activation also have vagus nerve dysfunction. Either they're stuck in freeze or they're stuck in fight or flight, and you can't heal when you're stuck in those states.
Right.
The rest and digest or the parasympathetic is the only way that we can really heal. So we need to address that vagus nerve stimulation to get somebody back into parasympathetic rest and digest can be different kinds of gargling, breathing exercises, meditation. There are devices out there. You can do biofeedback. There's this device called the ResiMax, which is great for people who have more pain. There's the Muse. Let's see, M-Wave, HeartMath. There's a ton of programs out there. There's lots of different ways to do this. And you can do this even if you're super, super sick, to start to stimulate that vagus nerve. And some people who have a lot of brain fog, who have a lot of cognitive issues because of their condition, that's a great place to start, along with the supplements, along with getting into a safe place, if it's a mold exposure. And then the limbic system retraining, I think that's the brain, right? The limbic system is the ancient part of the brain. That's our emotional center. That's how we process our experiences and remember them. And so the limbic system gets activated when we have these repetitive exposures to things, and we get stuck in this. Again, it's kind of the fight or flight thing, but that's really in the central part. That's our thought processes. These are our loops that we get stuck in.
Like habits.
Habits,
Yeah.
ways of thinking
Yeah.
about things, right?
Yeah.
And there are a variety of different programs out there for helping us retrain the brain, because we've been stuck in these like ways of thinking that aren't working for us. There's a program by a woman named Annie Hopper called DNRS. There's a program called the Gupta program, which has been very well studied also for chronic fatigue, fibromyalgia, and used for mast cell activation, like chronic Lyme disease. Annie Hopper's program as well. There's some other newer programs out there, Kathleen King, Primal Trust, and there's a variety of people who are doing similar programs. And this is really like working on trauma, working on the medical trauma. So people who are sick have been sick for a long time, and oftentimes they need to address that, that medical trauma that they've experienced, those doctors that they've gone to that have dismissed them,
Yeah.
saying, oh, you just need a psychiatrist, let me give you an
Oh,
antidepressant. That's not the problem, right? But that's all the tools that they have in their toolbox. So we need to address the limbic system.
right. So
Right.
that's like the subconscious programming that's
Yes,
running the show kind of thing and keeping us stuck in loops of fight or
exactly.
flight.
Exactly.
Yeah. I love, Kelly, that that model that you did, like the three the three legs of the stool, because as anyone knows, if you try to sit on a stool that has only two legs, it's not very stable, or
Right.
one leg, not very stable either. So you need the three of them conjunctively working together to create true healing. So so that's mind body techniques, and so you incorporate these in your practice with your clients.
Yes,
And
depending upon the person, depending upon my perception of their receptivity.
mhm,
I think that um, people come to a medical doctor and they expect to get supplements and dietary, especially a functional doctor. They want lifestyle, they want diet, they want supplements, medications. And some people are open to these conversations. And then there's a point at which you get some improvement, you get some traction, you get some rapport where they start to believe me.
yeah.
um, and then we can add that next piece in. Then I can encourage, right? I have one woman in particular I saw just the other day, and she came in, young woman in her mid 30s, like wasn't menstruating, terrible fatigue, lots of food sensitivities, mood up and down all of the time, gastrointestinal issues, chronic pain, you name it, she had it all. And we slowly chipped away at that. And then we were having a conversation. I was like, okay, I think you're ready. And I, made a book recommendation. I said, I think you're ready to start to think about this a little bit differently. And it happened to be a book by a woman named Amy Scher called How to Heal Yourself When No One Else Can. Feels a little
Yes.
weird as a doctor to say, okay, here you go read this book, how to heal yourself when no one else can. Like, okay, why am I paying you all this money?
Mm,
but it was the right prescription at the right time for her to open that book and say, okay, I have this trauma about being sick that I need to deal with. I've been sick for
mm,
so long. I need to start shifting it. Right. And that was the first step. She had to start to shift that way of being like, I'm sick, I'm sick, I'm sick, I'm never going to get better. Right. And
mhm,
then we did some more work. And then she started exploring this a little bit more, like, okay, why am I having these symptoms? What was the trigger? What was the trauma? How do I start to really heal that? Because I know that that's what it is. And so
mm,
she explored a variety of different tools. And this is where, it might be energy healing, it might be Reiki, it could be, biofield tuning, it could be all sorts of things, therapy, that starts to get the ball rolling, where people are starting to look inside and really see how their belief system is impacting their their function of their bodies. And I saw her just the other day, and she's doing great. She's like 80% better and so happy. She is a different person than the
wow.
person who walked through my door, right?
Yeah. Oh, you've got such a gentle way about you. And really, that's kind of how you have to work with people, because if you throw it all at them at once, of course it's going to be too much, right?
Right.
And your way of assessing, are they ready for this or are they not ready? Because someone has to be receptive in order for it to be effective, right?
Absolutely.
So
Right.
yeah, and books are such a great way to introduce people to that. Okay, so I know we're getting close to the end now, but there's just been really, really wonderful to introduce people to this topic, and also like for people that haven't heard of it. I live on a remote island, people aren't going to, I don't even think there's a functional medicine doctor on this island. So it's hard for people to get a different picture. So not that the audience is all here, we got audience all over the place, but people may not be hearing this from whoever they're seeking medical help from. And so you've given them an insight into, well, maybe this could be what's going on with me, and there are different tools available to me to help me get well again and live a full life again. So
Absolutely.
thank you so much for that work that you're doing.
You're
and
welcome.
and I know, I think I mentioned in the intro that you hosted this summit on mast cell activation syndrome. And so people can go find that. We'll share the links for that as well. And also, I'd love to hear from you, because this podcast is all about helping people really take health into their own hands, become empowered in their health. That's not to say they don't work with a practitioner, but that they are the leaders in their health. So what's a baby step someone could take today to start initiate healing in their body? Like, if you could give anyone any advice at all, whether they have mast cell activation or something else, what would be that one baby step?
The thing that we have the most control over is what we put in our mouth every day, right?
Yeah.
And so that's really where we have to start. We have to start with cleaning up our diet, and giving ourselves not only wholesome, nutritious food as much as possible, choosing organic, grass-fed, farm pasture raised, all of that. And then really exploring what are the things that make you feel bad in terms of your diet. If you're on, what we call that SAD, standard American diet, which is probably not what your listeners are on, but just in case, it's time to let go of that soda. It's time to let go of the garbage, the processed foods as much as possible, and clean that up. When I was in a moldy situation, I developed all these food sensitivities. I had been gluten-free and dairy-free for years. And now all of a sudden I was bloated after every meal. I thought, oh my gosh, what's happening, right?
Yeah.
And I knew I needed to figure it out. So I would make my meals really simple: chicken, rice, broccoli.
Right.
I get bloated, right? I'm like, okay, something in that meal is bothering me. So the next night I would have chicken, sweet potatoes, broccoli. I didn't get bloated. Hey, hooray, it's the rice. So I
Smart.
was very systematic about identifying which were the foods that were bothering me. And my list was really long, and it was not necessarily bad foods: rice, peas, almonds, apples, corn, soy, peanuts, eggs, gluten, dairy, tomatoes, peppers. It was a long list
Mhm.
of very common foods and the foods that people eat every day.
That
And
are
so you have
often considered healthy foods.
considered healthy foods, right? So it's really important to do that work to figure that out. And you have to avoid those foods for usually a month at least, and then maybe even reintroduce them to see which foods you're most reactive to.
Yeah.
I gave up eggs for a year. I didn't eat tomatoes or peppers for a year. I'm still gluten-free, dairy-free, almond-free, because that's actually an allergy for me. But you can figure that out, and it will make a world of difference. So that would
Yeah.
be the first thing that I would suggest people do.
That's a great suggestion. And as you said, be very like systematic about it. Like, you got to write these things down, because you don't
Mhm.
remember necessarily what you've eaten, and then being careful about the reintroduction, so that you're not muddying the information, right? You got to be like a scientist,
Exactly.
like a scientist
Exactly.
doing the experiment, one variable at a time. That's all you can test. Great advice, Dr. Kelly. Thank you so much for that. So, where is the best place people can find you? And I know you've got a gift as well to share with the audience. So maybe you could tell us a little bit about that, and then where people can find you.
So the gift is a frequently asked questions about mast cell activation. So it kind of goes through, you can read about it, of what mast cell activation is, what you can do, things like that. So I think that'll be very valuable for the people who are like, oh, that sounds like me, or that sounds like my friend. So that's a great
Beautiful.
place to start in your exploration of mast cell activation. And
Thank you
then
for that. That's
you're
a beautiful gift.
you're welcome. And then you can find me. I do have a practice in Southern California. I will be opening for new patients probably early March, mid-March. So people can find me there. That's thespringcenter.com. I do ask that patients come in to California to see me for the first appointments. And then Online, it's drkellymccann.com. So I have a website, I have a store. I will be offering courses. The first course is actually an environmental deep dive, really exploring what are the environmental chemicals out there, because we're bombarded by so many chemicals,
Yeah.
and what we can do about it. You know, how to investigate our personal care products, our homes, our hobbies, and where we might be getting exposed. So super, super important, timely information for anyone
Really?
who wants to be healthy and well, not just patients who are suffering from chronic conditions.
Oh, that's so good. We are exposed to so many chemicals, and it can almost seem overwhelming when you start to realize it. But again, baby steps, right? Like, what can we do to just start making it less and less? Thank you so much, Dr. Kelly, for this interview, for the gifts that you've got, for the work that you're doing in the world. I so appreciate that you're a medical doctor, but you're practicing integrative medicine so that people need the MD, like, to trust, right, what you're saying, but you're combining it all, so you've got a lot more tools in your toolbox to help people, and you're doing a marvelous job of that. So thank you so much for that.
You're welcome. And thank you, Jane, for all the work that you're doing and getting this word out there for people.
Ah, well, it's my mission. I have to do it. So, and I want to say thank you too for the audience for listening, for watching today. And maybe someone, chances are 1 in 5, right? Maybe someone who's been talking about maybe what's going on with them, or maybe you've noticed things about them that maybe it could be mast cell activation. So share this podcast with them so that they can learn, and you might really be changing the whole course of their life. All right, have a great day, everyone. Thanks for joining us.